Assalamu alaikum. Today's article is titled Postoperative Pain After Manual and Mechanical Glide Bath. It's a randomized clinical trial which was conducted by Italian group Pasqualini and others, and it was published in Journal of Endodontics in the year of 2012. Pain is a frequent complication associated with endodontic treatment, and it has a great impact on the quality of life. Treatment-associated pain has been widely discussed in a recent systematic review. However, data available from the existing literature may be overestimated because of the fact that even slight discomfort may be categorized as pain in some vast studies. The post-treatment pain may be caused by the apical extrusion of infected debris during chemomechanical instrumentation, which may generate an acute inflammatory response. And although all instrumentation techniques produce apical extrusion of debris even when the preparation is maintained at the apical terminus, the difference lies in the ability of some techniques to extrude less debris than others. The primary objective of this study was to evaluate the incidence of postoperative pain after glide bath performed with bath file versus stainless steel K-files, and the secondary objective was to evaluate the frequency of postoperative analgesics intake in both groups of patients. In this prospective randomized controlled clinical trial, a sample size of 280 patients, 140 per group, was required, and all patients included in this study were diagnosed with a diagnosis of asymptomatic irreversible bulbitis, symptomatic irreversible bulbitis, or bulb necrosis with or without apical periodontitis. And for each patient, bulbal and periradicular status was assessed through vitality thermal and electric bulb tests, palpation, and percussion. And periodontal charting was also recorded. Periapical radiograph examination was also performed. The subjects were then assigned to a different operator, randomly selected. Afterwards, patients were randomly allocated to the one of the two treatment arms for the creation of the glide bath. Root canal treatment was then completed 1 week later. In the bath file test group, the mechanical glide bath was performed by using glide as a lubricating agent with NiTi rotary instruments, bath file 1, 2, and 3. As for the K-file control group, the manual glide bath was performed by using a glide as a lubricating agent with a stainless steel K-files. Patients were then dismissed and received postoperative instructions and prescription for optional analgesics. They also received a 5-level pain scale form for postoperative pain severity evaluation. The 5-level pain scale that evaluated the pain severity was referred with 0 as having no pain, 1 slight pain, 2 mild pain, 3 severe pain, 4 very severe pain, and 5 extremely severe pain, which made the patient no longer able to perform any type of activity and needs to lie down and rest. Result of the study: 359 subjects were enrolled in this study. Overall, 16.3% of patients in the bath file arm and 19.3% in the K file arm were lost to follow-up. 10 patients in the bath file group and 15 in the K file control group did not present at the second visit, and 12 patients in the bath file arm and 7 in the K file arm had incomplete data. And 7 of 156 subjects in the bath file group, which represented 4.5%, and 13 of 159 subjects in the K file group, which represent 8.2%, experienced a post-operative flare-up with no statistical differences between groups. The statistical analysis did not show significant difference between groups in the prevalence of asymptomatic irreversible bulbitis, symptomatic irreversible bulbitis, and bulb necrosis, even when comparing symptomatic cases only. As for the postoperative pain, analgesic intake, and pain stop values, postoperative pain prevalence curve showed a more favorable time trend in the bath file group compared with the K file group. The more marked steepness of the bath file curve evidenced a faster resolution of the pain symptoms when present after treatment, and the difference between the two arms was more evident in the first 4 days. In both groups, the time to pain resolution adjusted for analgesics consumption was significantly different. 45 subjects in the bath file arm and 52 in the K file arm used analgesics. The mean analgesics intake per subject was significantly higher in the K file group compared with the bath file group. In conclusion, although interappointment flare-up is uncommon, postoperative pain is relatively frequent, also when the treatment is appropriately performed, and the patient should be informed about this risk. And within the limits of this study, the findings suggest that performing a glide bath with hand instrumentation may have a significant impact on individuals' quality of life in terms of postoperative pain, and the use of night eye rotary instrumentation may be rather beneficial.